Hi everyone, welcome to Self-Balance Live. I'm Szenan-Balance from Self-Balance, the acupuncturist. Now, today we're going to continue the topic of diabetes. We talked about diabetes yesterday, and we talked about what is diabetes and what are the symptoms of diabetes, and we answer a lot of questions for Irina and Kika, right? So now today we're gonna continue. We talk about the acupressure point as well, right? Acupressure point. Now we're gonna talk about acupuncture. If you're an acupuncturist and how you can use acupuncture to help with diabetes. And mainly we're gonna talk about is the diet, the diabetes diet, right? Hi, Irina, how are you? Yeah. Let me go to my Facebook and let me share. Hello. What time is where in your country right now? Hi, Yunuju. How are you? Thank you for being here and support me in this live video. Hi, Kika. How are you? Okay. Now we're gonna talk about diabetes, diet of diabetes. Thank you. I'm gonna share. So I want you to do the same. Tell me, I'm not very familiar with Instagram. All right. So in Instagram, can you share? Can you share to your friends with this live video? Now in Facebook and YouTube, I'll be able to. Hello, happy day. I'll be able to put the topic in, but I find if I do live for Instagram, I wouldn't be able to share at all. Ju said is 9:15 evening. Oh, okay. All right. We're in the morning, 7:17 at the moment. Yes, in Belgrade it's night. Oh, it's 9 o'clock at night time as well. Okay, cool. Good to know. So I presume that we are a day ahead of you guys. I think because in New Zealand we are the first one to see we are the first country, I think, would I be able to say first country to see the sun, the sun. Yes, we can share. Oh, thank you. Please share. Part of just engaging me, and the one more thing is share. You don't know how to share? I don't know either. Sorry. Yeah, sharing my live video, it would help more people because more people will receive this message, because I think a lot more people need to understand what is diabetes. And thank you very much, Irina. Thank you. And Kika, you probably have to Google and see how to share. I don't know either, because I'm not familiar with Instagram at all. Ju say yes, I'm sharing to my friend. Thank you very much. Thank you, Irina and Ju. Sharing is good to see. Thank you very much. Yeah, I would like to my goal is help as many people as I can. All right. So by treating patient in my clinic, that I help part of my patient, people. But I was thinking that how would I bring this even further? That's why I started a live video, because I think information is important. A lot of people haven't got the information, the right information, or the second opinion, or more information. Because what you get information online, it may not be the truth, and it may what you get the information from or solution or information from your GP, family doctor, or the experts, they may not be it may not be the only way that you could listen to, right? So there are many way and many way that you can do, you know. But you may find that you run out of options because everyone do this, and you have to do this even though you doubt about it, and you can't do anything because there's no support and there's not enough information for you. Okay, I'm so sorry. You're far away, not even in Europe. I feel your knowledge and good energy. Thank you very much, Kika. I know. I'm pretty sure that in Europe there are a lot of acupuncturists. They are good, or there are other alternative practitioner that you can find. It's just not many, but it definitely they are. You know, they are. Hi, Veronica. How are you? Good morning. Happy day. Say it is 8:17 p.m. here in Nigeria. Hi, Jack. Nice to meet you. We're going to talk about diabetes, continue the topic of yesterday. We talk about what's diabetes, what causes diabetes, then the acupressure point for diabetes, and we're going to talk about acupuncture point for acupuncture. If you're an acupuncturist, you can do acupuncture for diabetes today. And as well as the more important thing is the diet. All right. So let's review, you know, what's going on with diabetes. Just a quick review. Okay. So like we talk about the diabetes. Okay. When you eat, your pancreas actually produce insulin. Okay, the insulin, what is the function of insulin? We heard about a lot about insulin, and we talk about the insulin is actually reducing the glucose, but actually the insulin actually has a function to take the blood, bring the glucose in your blood, right? Send it to the cell, and cell. So therefore, the cells be able to use the glucose, which is sugar, okay, as an energy source, you know. So we all need energy. You know? The cell need energy, you know. How could the cell get the energy? Rely on insulin, right? Without insulin, the glucose, the sugar, won't be able to reach the cell. Therefore, there is not hasn't there are a lot of glucose stay in your blood hasn't been used. That's why causing high blood sugar. Okay, that is one of the that's the idea, right? So that's because the cells we call we said about there's a term that everyone know about it. We call it resistant. Your body become resistant to insulin, right? So hi, Juliana, how are you? So this is type 2 diabetes. All right. So if you're on Facebook, please share this. Give you a thumbs up and say hello to me. Then share this live video. Okay. I think many people need that. Okay. I just found that yesterday, Irina and Kika, you both suffer from diabetes, but you haven't got much option and information, and you actually on metformin. And when you're on metformin, you both have side effect of for metformin, right? So both of you have stomach problem, and you know, so those are not good, right? Let's talk about now. Is hi Jika, nice to meet you. So let's talk about it's very rare, and you know that the treatment of insulins, you know, injection one, you know, injection insulins, it actually for type 1 diabetes, it should not given to type 2 diabetes. The reason is here. We haven't talked about this yesterday. We didn't talk about this. Yeah, that is because type 1, you know, insulins, your pancreas produce insulin, Yeah, the insulin in the blood bring the glucose to the cell, right? Let's say if you produce less, or you can't produce insulin at all, right? And that's type 1 diabetes. So type 1 diabetes, the pancreas lost the function. It can't produce insulin. That is why without insulin, your cell can't get to glucose, right? That is why the glucose, the sugar in your blood, is getting higher and higher and higher. That is what causing high blood sugar. That is type 1. That is type 1 diabetes. All right, type 1. Which means in type 1 diabetes, your bloodstream got a lot, very high glucose, but not enough insulin or no insulin at all. That makes sense? Okay. Now, what is type 2 diabetes different with type 1 diabetes? Right. The type 2 diabetes is because the cells resist. Yeah, we call resistant to insulin. The cell resists the insulin, which means the cell's not accepting the insulin and the glucose. That's why in your bloodstream, your insulin is high. Then your glucose is high. So it's different, right? Type 1, high glucose, low insulin. Type 2, high glucose, high insulin. Okay. Now, the highest insulin you get in your blood, and the resistance to insulin will be worse. It get worse, right? So it's different. Once we know this, we know that type 2 diabetes, giving you insulin injection for type 2 diabetes is wrong. It's a very wrong move. You shouldn't do that, right? So not just me talking about this, okay? I do a lot of research and I treat diabetes. And I want you to go to YouTube and to understand more, to get more information. And there's just Jason Fung, okay? I think is American Chinese, okay? American Chinese. He's a doctor. He talked about this. Jason, Jason, Fung, 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 okay? Is a American Chinese doctor. He helped a lot of people using diet, fasting and diet, and to get rid of type 2 diabetes. We're not talking about type 1 diabetes, okay? Right now, we're not talking about type 1. We're talking about type 2. And he actually, there are a lot of video on YouTube about him, right? And he talked about how to reverse type 2 diabetes, right? So it's very valuable informations from him, right? He talked about this, Then he actually introduced and talked to a lot of doctor, those doctor, they are practicing. Do you know for Dr. Eric? No, he is great too. That's good to know. Now I will search him. Yeah, definitely search those. Okay, let me put it down here. Dr. Eric. Okay, let me subscribe to his YouTube. That's great. Thank you. Yeah, that's good. Good to know. Thank you, Kika. Give you information. That's what I love. You know someone that I don't know, then you give me the information, and I would like to have a look, check it out, whether that is valuable for me or not. I'm always searching and keep it hunger to find more and more information, and for me to use for my patient. Gain knowledge is the king. Knowledge is powerful. without knowledge, you can't change your life. You can't make decisions. We all make decisions based on our knowledge, right? So getting the right knowledge is very, very important. It's very important. Okay. So yeah, check on Jason Fung. is cool. He has short lesson but very true and logic. That's great. That's good to know. Thank you, Kika. Okay. Now so let's talk about in the website. If you go to the diet, all right, we talked about medication yesterday, but today we're going to talk about the diet. Diet for type 2 diabetes. Okay, on the website I just pull out random one. Okay, the diet is an important tool to keep your heart healthy and blood glucose level within a safe and healthy range. Yeah, it makes sense. It doesn't have to be complicated and unpleasant. Yeah, it doesn't need to be that. The diet recommended for people with type 2 diabetes is the same diet just about everyone should follow. It boils down to a few key action. Okay, let's see what the few key action from this website. Okay, I will tell you what I agree with and what I not agree with. Okay, it's a eat meals and snacks on schedule. Yep, I agree with that. And choose a variety of food that are high in nutrients and low in empty calories. Okay, yes, that's pretty good. Yes and no about the calories. I have different opinion with that, but it's okay in diabetes. Okay, and it's okay if you follow this. Be careful not to overeat. Totally agree with that. In Chinese medicine, in the Chinese culture, you say if it's 10, you have 10 level 10. Yeah, you only eat 7. 7 full. If 10 is very full, good enough, you only eat to 7. Keep the hunger, keep a little bit hunger that it'll keep you live longer. That's a saying in Chinese culture. We call 吃七分饱. It only eats 7. 10 is the food. You only eat 7. It keep about hunger. When you keep about hunger, people overeat right now, and when you overeat, you feel tired because all your energy just go to your stomach and try to break down all the food, and you use all the energy, focus all the energy in your stomach. Diet with low carbs. What about 5 times eating, 3 main meal and 2 snacks? That's okay. That's okay. Yeah. That's different thing that you need to test out yourself. Okay. But I would suggest my patient that some people get break down a meal. It's not taking. They are not eating big meal, but in between they snack. That's one idea for snack. But it doesn't suit everyone. It doesn't suit everyone. That you need to test it out yourself. Eat it that way. Then you see how your blood sugar controlling. Yeah. Because whenever you eat, as soon as you eat, your body stimulates the pancreas to produce insulin. With the insulin resistant, it may not be a good thing for you. Okay, but it may be okay for you, and I really don't know. And how do you test it out? You can test it out by just testing your blood sugar to see how stable is it. All right. So sometimes some patients, they need to keep in. They can't do this like 3 main meal and 2 snacks. And they have to go without snacks in between. And that's pretty uncomfortable because some people just get used to snacking things. But for my opinion, most people fine with that 3 main meal, 2 snacks. Okay. We need to see about what if I skip 1 meal. A lot of people naturally do fasting. Fasting is a great thing to do, all right? But you need to know how to fast. I do often fasting. Some fasting 1 meal. My master only have 2 meal a day. They only have 2 meal a day, and they get more energy. And they look younger. So in our culture, we talk about 3 meal a day, right? Most people, but eating less is what I reckon. Eating less is actually better than eating more. What do you think about auto fungia? Okay, we'll talk about that later, right? Let's continue, okay, about this. Hang on. Where are we up to? Okay, let's see a look. Okay, food and beverage to avoid. There is said about some food to avoid over here. Okay, there are certain foods there and beverage that you should limit or avoid entirely. This include food heavy in saturated fat and trans fats. Yeah, I agree with that. Yeah, organ meat, such as beef or liver, right? And I totally agree with that. Okay, and processed meat, yes, shellfish, margarine and shortening, baked goods such as white bread. Yeah, white bread is not good for diabetes. Yeah, and high fat dairy products. Yeah, no, I would tell you that again. If you go for Google about this in the what do you call it? The diabetes guideline in New Zealand, I talk about that. I went to expos and they people there and to do free stuff for all the people passing around and to get their blood and tell them that oh yeah, you have diabetes and you need to do blah blah blah, and give them a guideline, and those guidelines is not going to help them. It's not going to help them. They actually bring awareness to people about diabetes, and it's a good thing. But in the diet suggestion, they suggest them to eat meat, fish, to have dairy, certain dairy, milk, And when I look at that, I say, no, those people are not going to get better. Those people are not going to get better. Why is that? Because those diet will keep them, even they have low carb, low sugar, no white bread, the blood sugar was still high. And the blood sugar will be better with what? With metformin in the beginning, and then you find out, oh, if you have side effects, it won't be good. You will stop, and they'll change another drug for you, and they keep going. At the beginning, you say, oh, okay, the blood sugar is quite stable. And we keep going for, we talked about last night in my other platform in Chinese. I say, well, if you try to do medication for this, you feel good in the first place, but it always out of balance. It always become uncontrolling. Always. Okay, I haven't seen anyone that can be good controlling about diabetes. All right. Yes, Kika, I'll tell you what to eat later. Okay. They say food to choose. Okay. Sweet potatoes, whole grain, they are good, such as oats or quinoa. Quinoa is the best thing you can do. Yeah, it's very good. Legumes is such as beans, non-starchy vegetable, whole fruit. This is a healthy carbohydrate, can provide you with fiber. The option including just what I just talked about, and that's another food that food with heart healthy omega-3 fatty acids including. That is what they recommend as well. They recommend tuna, they recommend salmon, that is something that I personally don't agree with. Okay, I'll tell you the reason. And flax seeds, you want to get omega-3, get it all from plant, not for tuna, not from salmon. Why is that? Because if you just want to get omega-3, to help you stay healthy, choose the plant one, the plant-based one, because tuna and salmon are full of animal protein. So basically, again, we're going to go back to the book. I still want to recommend you the 101 book, which is the China study. Right? The China study, Dr. Campbell has been done of 20-something years of research and about diet, and about disease and diet. Right? Omega-3 from Chai tuna is full with toxin. Yes, that's right. Full of toxin. I do agree with that. And salmon as well. People think about salmon is good, but once you read the book, of the China study, then you know why. Animal protein is not good. I'm talking about animal protein. I'm not talking about just meat. What have full of animal protein? Even your egg, your dairy, and they've done a lot of research, right? So yeah, omega-3 from chai seed is good. Yeah, chai seed is good. So those things you need to read the book, to be honest, because as I said yesterday, that when you go for plant-based, plant-based are more easy to digest, very, very easy to digest, and you don't use up a lot of energy. Okay, and go for Jason Fong, and he will explain why all this changing your diet will save you, will lower your blood sugar. And I've seen a lot of people do that. All right, so we talk about lime. Lime is a good thing to do. Okay, very good thing to do. Right, I will read what to Google China study book. The China, THE, the China study book. Yeah, I start to read that book. Thank you. Dragana, yes. It's a bit boring, to be honest, that book, because what happened is talk about research, it talk about study. When they talk about research and study, you find the rule of research and study, it talk about those stories, and some story is a bit boring, but it's very valuable. It's very, very valuable. All right. It talk about heart disease, it talk about diabetes, it talk about how all this actually related to the food. And it talk about how he found out all this thing, and in China, and the disease happened in China and in the US, and how he compare all this thing, it's great. It actually helped a lot of my patients when I get them to read it, because this information is very, very valuable. All right. So basically, I suggest plant-based diet, and there are a lot of information on YouTube, on Google, and about plant-based diet, and you should research it and type it out for type 2 diabetes. I talk about a case that he and his mother become vegan and plant-based diet. His mother about 80 years old, and he suffered from diabetes type 2, and his mother too, and he actually got the vision problem, like the eyes, because of the diabetes, and numbness in legs and hand. And he went to Google, and he just about gave up he can't drive, no driver license. And what happened is he went to Google and tried to Google what is the best for diabetes, and Google suggests you, right, what would the type. And he said when he looked at it, wow, how to reverse. A lot of people on how to reverse diabetes. He hanging over there. What? Reverse? Yeah. His mindset changed. Yes, why didn't I try to reverse it rather than control and manage it? Because I have been control my blood sugar for years and without any result, and now I have to give up my driver license. So he searched it, and the most people talk about reverse is from plant-based diet, and he actually get became a vegan and went into plant-based diet, then reverse his diabetes. How do I say reverse? His without medication, his blood sugar become normal first thing, and his eyes, he can see properly, he gained back his license, he can drive, he can drive. And then his extremity was numbness and painful, very sensitive, and they're all gone, those symptoms all gone. Yeah. Then what happened is, I love that thing that he does in his community. He actually went to support this person into his community and talk about his experience. He actually encouraged his mother, 80 years old, diabetes, type 2, and was on insulin injection, I think for 7 years, something like that. And his mother went on a vegan plant-based diet. I think for about 2 months, and then throw away all the injection type insulin injection. This is so powerful. You see, this is so powerful. People on insurance, you can reverse it. You can reverse type 2 diabetes. And not just me saying that, there are a lot of experts, they treat a lot of diabetes through diet, and hey, it's simple, but you do need the right information, right? So go for Dr. Bennett, Neil Bennett. He talked about all this as well. He is a GP. He is a plant-based diet doctor. He's a nutrition. He talked about all this as well, and it's great, And he talked about all the science, all the study and research, and encourage you and give you the right information how to become plant-based and reverse your diabetes. All this thing. And there are a lot of other doctors, they talk about this as well, and it's amazing. It's amazing. So I'm here to give you information that plant-based diet, and we're going to talk about diet in the future, but I want you to do the research and get the book, the China study. First get the book, the China study, and read about it. It's not just about diabetes, it's for everything. And Kika, there's a book called Fertility Diet. Fertility Diet is based on plant-based diet. The cover is pink with a lady carry a baby, put it in that way. So if you see a lot of other fertility diet, it will based on the hormone and tell you what you need to eat, what you can't eat, all those things. But the one that I recommend you is the pink color, and it talk about fertility diet. And you search it, you see a lot of different fertility diet book, and you choose that one and match with the China study. Yeah, and you feel, oh, they all make sense. They all make sense, right? And it's easy to do. To be honest, it's easy to do. I've been a vegetarian and vegan for the last 16 or 17 years. Yeah. And my mom has high blood sugar, but hasn't been, never been diagnosed with diabetes. Dad has diabetes and high blood sugar and diagnosed with diabetes. So my grandma, my mom's side, my grandma, not on my dad's side, my mom's mother, diabetes. So you would think that, yes, My mom suffer from diabetes, that is normal, because genetic issues. It's not. We reverse it. My mom's okay. Right now, it's still okay. And how do we know that? Because we test her blood sugar every few months, 3 months or 6 months. It has been fine since it was three, they've been here for 3.5 years. Blood sugar is fine. JK Anna Paul Saji I mini Ako Niger problem. I have no idea what you're talking about. But it's good. That's good. Yeah. So does she eat sweet fruit? Yeah. That's something that we should talk about in the future, about the sweet in fruits. Okay. My dad, they love fruits. The sweetness from the fruit is no problem for them. I'm not talking about you though, because yeah, there's a lot of saying about fruits. Too much. Like someone talked to me that no citrus, right? I don't know whether it's Kika or Irina, and no fruits because the sweets in there, right? So in a proper way, I would say no fruit juice. No fruit juice. Why is that? Because fruit juice are different with fruit. Fruit got a lot of fiber. When you just take fruit juice, the sugar in that is high, right? So when you take fruits, and that actually got a lot of fiber, it help you pass out all the bad thing, and it's good. It's fine. It's fine for my mother and father and my father, because they love having fruits over here, and I didn't stop all the fruits for them. Yeah, no juice, but only from vegetable. Yeah, vegetable is is less sugary things in the juice. Yeah, and but I would suggest, smoothie is fine. Why is that? Because you still have the fiber inside, but I would say that you eat using your teeth to choose all the fiber and your fruit is better. No fruit juice. No fruit juice. This is my opinion. All right. I won't stop my patient to take any fruit, but I would say that I would suggest you no fruit juice, but fruit is okay. Right? And that's what I suggested. But there are other opinion. If you find out, no, even just fruit, it will your blood sugar up and down, then don't do that. Don't do that. You just avoid fruit. Without fruit, you still stay healthy, right? As long as you eat your vegetable. And again, how do you get to your right nutrient? Okay, when it comes to plant-based, and we talk about even for diabetes, and people worry about, and those patient family, would you get enough nutrient? I said yes. Why not? I said, well, look at the cow. You eat meat from cow, from pig. What do they eat? From You eat lamb, sheep. What do they eat? How do they grow their muscle and grow the meat? From plant-based. They never have any other things. But you will say, oh, we are different. They're animals. We are human. All right, okay, but we have heart. They have heart. We have intestine. They have intestine. We have stomach. They have stomach. Pretty similar structure. Food with almonds good for blood sugar. That's good. Good to know. Thank you for the valuable information, Kika. Very, very good. Okay. Now, more thing about it. So in Chinese medicine, we talk about 5 elements, right? 5 elements. Then the nutrients thing, nutritional thing is very new. Okay, we talk in Chinese medicine. We don't talk about nutritional because we don't have the word. This is in the Western world, when the Western medicine came and the scientists came and they talk about nutritionists. So they bring the food, whatever they eat, and put it in the lab and check. Oh, you had this vitamin C for vitamin C in kiwi fruit, and fiber, and vitamin A vitamin B, vitamin B12, all this thing. They try to figure out what's inside, or they have sugar, give you a carbohydrate and calories, everything. It tests out all separate thing, and to let you know this is what your body need, have mirror all this thing, it tell you all this thing. But in the past, think about it, in the past, your grandpa, your great grandpa, your great grandma, they didn't know about nutritionists. Did they live okay? Did they live healthy? They're probably healthier than us, Then think about the 1,000 years ago. Chinese medicine has been doing an acupuncture. We have 5,000 history of Chinese medicine. Think about 5,000 years ago. They didn't know about nutritionals. How did they eat? 5,000 years ago, they didn't know anything about vitamin C, vitamin B12, mineral, but they are still healthy. So what kind of idea did they get in their mind? Simple. And Chinese medicine is simple. We talk about 5 elements, and we have our own nutrition knowledge. 5. My wife, I didn't know about that term of they call my wife say rainbow diet. He said she said, because she listened to my voice of live video when I talk about things, and she sometimes watch it and say, yeah, your rainbow diet is good. I said, what rainbow diet? Oh, I realized it. Yeah, all the color. Is it all the color? Okay. So what I do is I just make sure that I have 3 color meal. Every meal, I make sure I have 3 different color. Let me give you some idea in Chinese medicine. We just look at the color. When we talk about nutrients, okay, nutritional, okay, we talk about the red color is go for your heart. Linked to the fire, element fire, and the wood, trees wood. What color are they? Green. So green, it has the nutritional for your liver and gallbladder. Okay, for the tendons. Okay, that is linked to wood and liver. Okay, green color. Then what about stomach, spleen? That's linked to earth. Okay, and that's yellow color. Anything yellow, they're good for your stomach and spleen. All right. Then white color like cauliflower and broccoli, and not broccoli. Broccoli in the stomach part is white color as well, and cabbage. White is good for metal, which is your lung and large intestine. Those nutrients will support your lung and large intestine. This is Chinese nutrition. And the black color and all the beans, seed are good for what? Good for kidneys and are good for infertility issues. Good to support your the infertility organs and fertility organs, and to support the kidney and bladder. Right? This 5 different color: red, green, yellow, white, black. 5 different color. Now in the past, when I get the information from here, and my master said you have to make sure you have 5 different color in your each meal. I said that is too stressful. It is too stressful, especially black color. Very difficult to find in the Western food, But I'll tell you, black bean, black sesame, they are all black, okay, and all the beans, it look like kidney if you go to there. Again, my daughter loves beans. She has beans every day, and beans are full of protein. And we talk about quinoa. Quinoa has a red one. Red quinoa is good for heart in Chinese medicine. And what else? it's seed, so it's good for kidney, right? So the yellowy quinoa is seed, is good for kidney, and as well as yellow, it's good for stomach and spleen. Simple. It's very simple. This is a Chinese thinking and Chinese medicine of nutrient. And think about, let's say about bok choy. I don't know about what Shanghai bok choy we have here in bok choy. Bok choy is a Chinese vegetable, green and white. So green and white. Look at green and white. Green, this bok choy is good for what? Liver, which is green, and the white part is good for lung. All right. So when you eat it, the taste. I haven't talked about taste. Let's talk about taste. The taste, it tastes in the summer. If you eat bok choy, it actually bitter, and the bitter taste is actually good for heart, right? Then when you eat and you chew, and it becomes sweet. If you are, it's not bitter now, it's actually sweet. And what's sweet? Sweet is good for stomach and spleen. So all the taste is actually a nutrient good and will link to one of the organs. So by taste the food and by look at the color, you know what the nutrient will go to. So it's very, very simple in Chinese medicine. So what we do is, in my meal, I just tell my mom, okay, we just need to make sure that every meal we have 3 different color. That's it. You don't have to make sure that you have 5. If you can do 5 colors, that's good. But at least 3. Okay. But I'm not saying that you always get red color, green and white color in every meal. You change. You change the different color in each meal, so it make it easy. So it's not stressful. At least 3 different color, and you will get all the nutrients you need. And we've been eating that way for a long, long time. As I said, I'm plant-based for about 16, 17 years, and I take my blood test every year, and my glucose is fine, my cholesterol is fine, hasn't got any problem at all. Every year, and everything's fine, right? Veronica said, can you talk about Chinese medicine treatment for losing patches of hair with no evident reasons? Veronica, this is a difficult case for losing patch of the head. Using ginger. Chop the ginger off and just scratch on the patch, okay? And normally people lost the patch of hair is because of the stress, and it's very difficult because you have to remove the stress factor to where it go back again. It comes suddenly. It just comes suddenly, yeah. And if acupuncture, you just do the needle around it, just get the needle underneath the patch, And another thing is bloodletting on the patches. I don't know whether your patient will bear with the pain or not. This is painful if you're bloodletting about that things. Kika say, how are Chinese people healthy when rice has high grace milk intake and sugar? I'll tell you, Chinese people are not healthy right now. If you go for the China study, and you will see the Chinese people have a lot of disease because of the Western diet that has been introduced into Chinese community. And the Pizza Hut, the KFC, they have to. And in here, I don't see people go to Pizza Hut, KFC. They have to queue. A lot of people want to join in and to buy things. Can you write the plant's name? What plant name do you want me to write out? Irina, I'm not. Can you tell me exactly what you want? The Chinese people, no, the Chinese people are not really healthy right now. And the China study, the book is talk about uh, the reason they call China study, it want us to follow the Chinese culture eating is because uh, before the Western, the American food go to went into China. They are quite healthy. Of course, we all get sick. No one get perfectly healthy. Even though a vegan plant-based diet, you get healthier than the meat diet because we need to make it so clear in here. Diet is important. Diet can improve your health and make you healthy, but what make you sick? Yes, diet make you sick if you're in the wrong diet, and emotion, stress make you sick. Too busy, you look down your lifestyle. If you go to bed very late and your routine is not good, they ruin your life and you get sick. So by just changing your diet, become plant-based diet, the vegan, you change your lifestyle. And I'm not saying that you won't get sick because people still they're on a good diet, but they have a lot of stress, and they probably live in an environment that's not healthy, or they in their job they probably have to touch or deal with toxic things, heavy metal things, and therefore they do get sick too. All right. So just want to make it clear, and because for me, you hear that, oh, you're talking so perfect about a plant-based diet, but there are a lot of people still get sick. And now I talk about the China study, and I will tell you the truth: the Chinese people are not healthy right now. The China study talk about before the American food introduced to the Western food introduced to China, they are quite healthy. They're healthier than ever. But since the American fast food introduced to China, and they have been more food, and the nutrition's what's a healthy nutrition idea, and suggesting milk, they eat it every day and every meal, and that make the disease change, and the disease pattern is so similar. Is similar to the Western world. And before the diet introduced China, and the disease pattern is so different with the Western world. That is the book and China study talk about this. And I asked my dad when my dad was young. He lived in Malaysia. He was born in Malaysia, and my mom as well. They're so poor in China. They were so poor. They have no money. And what do they eat? I asked my mom. My dad said, "Well, my grandpa, they have farm, but they're still poor. They have chicken, they have pig, What do they go there for? They feed them for once a year. When New Year, they're allowed to eat meat. They're not vegetarian, to be honest. They are not plant-based, but they live in plant-based diet. They live in plant-based diet. They have no money, literally no money to buy meat, to buy chicken, to get pork in their diet. They only have vegetable every day in their meal. That's how poor they are, And that is what the same thing in China. Because growing a chicken, my dad said, chicken you have to 6 months. To grow a chicken is 6 months. 6 months to grow them big, and then yes, you cut them, you kill them, and then get the meat. That's in reality. And now, how many weeks? 4 weeks. 6 months versus 4 weeks. Think about it. What are those chicken having that can help them grow that fast? They are not eating the way they eat. They're eating something that has got some drugs in it, so help them to grow bigger. That is why a lot of medication, antibiotics, and what do you call that? 技术, I know in Chinese, but steroid. The steroid medication and the antibiotics are both are most used in animals than in human. So think about it. All your meat contain the medication they have been taking. And yes, you're not sick, so you won't go and take the antibiotic. Yes, you're not sick, but you won't get and take steroid, but yes, you are still having it every day in your meal instead of taking medication. Those medications are actually in your meal. Believe it or not, there's a lot of things have been proved that. You see, I have never saw fat Chinese girl or boy. Yeah, there are a lot. There are a lot. Yeah, there are a lot. In China, I can show you the picture. Yeah, I lived in China for about 6 years. Okay, Irina, I'm sorry. I'll just give you the color again. You might have to have a pin of it, or I'll post it on my Instagram later on. So I'll repeat it again. The red color is for your heart and small intestine. We call fire. And do you get me? If you follow me, I'm gonna put it slow. Okay, we'll repeat again the color. The red color is for heart and small intestine, right? And then 5 element is fire, right? I'll type it out again later on. The green color is for liver and gallbladder. The green color is for liver and gallbladder. And in 5 elements called wood. Okay. Then it comes to lung and large intestine. Lung and large intestine is white color. And white colors for lung and large intestine. And the 5 element we call metal. Okay. And yellow color is for stomach and spleen. And in the 5 element we call earth, right? Then the last one is black color. It's for kidney and bladder, and that is for water. Okay, so I think it's up, and Instagram allow me to do 1 hour of live, and it just remind me I have 1.5 minutes to finish this. Just name of plant. I wrote down all others. Oh, the plant. Whatever plant you can see, you look at the color, then you know which is for. Like broccoli is green, right? It's good for liver and gallbladder, right? But the stalk of broccoli, it's green in here, but whatever in here is got white as well. And those white people just eat the green, but we eat the green as well as the white part. And that part is good for what? It's good for your lung and large intestine. And cabbage, you see cabbage, and they are purple cabbage. Purple cabbage is purple is between black and I see it between black and red color. So it's good for heart. When you do purple color of cabbage, the soup will all become purple. It's good for blood. Good for blood. Then the bok choy. The bok choy is Chinese green. Any green, like just one of the example that I brought up. You can go for Asian supermarket and look at you don't have to purposely choose the Asian Chinese plants. Any plant, at a healthy, look at the color. look at the color, and you have the principle. I want to give you principle rather than tell you, hey, you should eat this thing. The principle is important. Okay, it's about 6 or 5 minutes. We're gonna close this now. We're gonna see you tomorrow. Okay, see you. Bye bye. Now, the Instagram cut off itself. Yeah. Okay. I just started again Instagram. All right. I see some question over here on Facebook. Can you talk about Chinese medicine for? Oh, we have this. Could you one day talk us about Bagua and seasonal point? Are you saying, Virtuous? You saying about the Bagua and seasonal point? That is for what? For the balance method acupuncture. Am I right? So if you're talking about all this, we have a class, a webinar. If you want to learn the the balance method acupuncture, I suggest you do it with local balance first, because local balance is the basic. If you're without local balance, the basic one, you want to go for seasonal point. Seasonal point is actually the advanced class, and you won't be able to understand all this. First get the global balance, local balance, understand all local balance, and then global balance. And I have actually have a webinar. Yes, you have to pay for it, and it's $299 or $299 US. It will show you all the Bagua and where all the balance method acupuncture come from the Bagua. Then and you will learn step by step from the webinar. For the image, how to choose the point, and as well as how to what are all the 6 balance meridian is, and how to quickly choose 3 meridian to balance all 12 meridians. When we see patient that if the pain involve a lot of meridians, you want to choose as less as meridian to treat it, rather than you choose all 12 meridian. If you're 4 meridian involved with the pain, 6 meridian. So if you can choose just 2 meridian to target 4, to balance 4 meridian, to treat those 4 meridian, you rather just choose 2 meridian instead of using 4 meridian to target all 4 6 meridian. So they are all available in our webinar. Can I pay for this webinar, please? I want to learn this. Tell me how to pay. Yes, Veronica, I'll send it to you. Okay. And Veronica, I think you have paid for the Auckland one, but because of the coronavirus, and you can't get in. For everyone that who have paid for the workshop, and you get free of the webinar. I'll send you the free one, Veronica, because you have paid for the workshop already, and I'm not doing the refunding for this, because you said no for refunding. You just wait for the next workshop, and we'll keep that for the next workshop wherever you can attend it. So we keep that for that, and then I'll send you the link to go to the webinar, and whoever join my workshop, and they get free webinar for local balance. Yes, that is what I wanted. I should send it to you to get a free webinar, and you can start straight away with the free webinar. Can we have link for webinar? Irina, that is for acupuncture actually. Yeah, that's for acupuncture. Are you an acupuncturist, Irina? Are you? I thought you and Kika are not an acupuncturist. I probably took it wrong. I'm sorry. Are you an acupuncturist? No. Yeah, no. It's not for you. It's not for you. It's for acupuncture. In my platform right now, I have acupuncturists come and join me. No, it's okay. It's okay. I didn't make it clear, because yeah, we're just in the middle of conversation with my Facebook friends, my colleague in Facebook, and yeah, you just came in the middle of our conversation. That's why you didn't understand it. That's okay. That's okay. But no, in the future, what my plan is, I haven't the time to do it. You probably can follow my. I'm interested in some education if it's possible. Yes. What I do, if you go to my if you for your self use, yes, I introduce all. So with acupuncture, what we do, we call balance method acupuncture. It's from Dr. Richard Tan, one of my Sifu, my master. This method is great. It's very, very easy to use, and in fact, I actually simplify it. Okay, I simplify it that if you're not an acupuncturist, you don't need to learn the meridian. You need to just see the image. You just need to learn the image. For example, what is the image? Okay, I'm going to show you. Have you ever seen puppet show? Me and my daughter play puppet show. We have rehearsal and we perform to my wife, just for fun, So the puppet show is like this, if I got sock, all right. So this is my daughter's sock. We use this to do the puppet, and her sock got not this one, got her sock's so cute, and her 2 eyes and nose, and eyes and nose, and when you do this, it actually like a person, eyes in here, nose in here. Not this one though. It's the other one. I can see it here. So we do this, and you say, "Hello, I'm Szenan. Nice to meet you. Today I'm gonna talk about diabetes. So have you suffered from diabetes? This like this, Yeah, without needle, we do acupressure point, right? So this is the idea. So when I do this, you see, this is a head. This is like me. I'm talking about it right now. This is me. This is a head. This is your neck. This is image. We're talking about image. And come to here. This is my chest. And tummy and belly button over here. So once we have this idea, we know how to treat the person. That is why when I introduce the chest pain, if you watch my video previously, the chest pain, we use the point over here to treat. Normally we talk about meridian, but for my idea for you is I'll just give you the area and I show you where exactly you need to press on it. And on this area, you go and find the sensitive point. Just go, and this area, just go from here to here. You need to press it. It's so simple. Oh, this is quite sensitive. So I press over here. So I want to make all the video in a webinar. Of course, you have to pay for it because I actually teach those things. But in my live video, daily live video is all free. We talk about disease, and I'll show you some acupressure point that you can do. For those acupuncturists, if you watching this video right now, for the you can go for medical 12, medical 8 plus 1. Those strategies are good for diabetes. You can treat diabetes, and you can test it before and after, and it can drop the blood sugar. And if you want to treat diabetes and you want to test out whether this strategy is working or not, what you have to do is get the patient empty tummy come to you. Empty tummy. Yeah, I know we talk about empty tummy is not good for acupuncture. Lay them down and put needle in and take the blood. Yeah, thank you, Irina. I know it's totally okay but I haven't got it ready yet. I haven't got this ready yet. But once I'm ready, I'll put it out in for everyone, and you guys can choose whether you want to buy it or not. Okay. For acupuncturists, this is how you test it out. Whether it's we know medical 12 and medical 8 and medical 8 plus 1 are good for all the organs, and it can treat. Thank you, Irina. It can treat diabetes, okay, and it can instant release reduce the blood sugar. And this is how you do it, okay? Get the patient first thing in the morning or empty tummy, or if they have food, and after 3 or 4 hours they come to clinic. Then lay them down and get a blood test and read the blood sugar reading. Then you put needle in. After 20 minutes or 40 minutes, whatever you want, or half an hour, take the needle out and do the blood test again. And show the patient before and after, and you can see it before and after. If it drop, which means this strategy is good for your patient. Yeah, that's how you choose whether it's medical 12 or medical 8 or medical 8+1. That's how you went, which strategy can help this person. All right, that's how I do it. And I have the other, like treating my mother and father, I don't do medical 12 and medical 8. I actually take the pulse and just put 2 needles, literally just 2 needles. And the pulse balance, and I take it out. That's it. And within 10 minutes or 15 minutes, I take it out and I test it again. The blood sugar drop. And I test it that way is when they are all empty tummy. And I be able to do that because my clinic just locate where my parents live, only 5 minutes. They should walk down here, or 5 to 8 minutes, walk down there, and I give them treatment. And sometimes I do treatment at my parents' house. I went there and I said, "Have you had breakfast yet?" "No." "Okay, start acupuncture first." And we do the acupuncture first, and we test before and after. And I have a lot of picture about proof that there's actually and the time is on there, the date and the times on there. How many minutes before and after, and it works very well. Okay, can we do scalp 12 needle? Yes. Veronica, I don't know whether you know about how to do scalp 12 yet, because we used to do it in the night time of the live video, and I do scalp. So scalp on the Bai Hui point, right? So you do this, put 2 needles first, 1, 2, 3, 4. Then you have 4 gap, right? In each gap, you put 2 needles in. And remember, the best path for it is, this is Bai Hui in the middle. And each needle actually go through Bai Hui, go to the opposite side. Which means the needle is like this. This is Bai Hui point, it go through here, go to the other side. Right? So that side of needle, this is Bai Hui, it go through here, it go to the other side. Okay, go through like this. If you put the 12 meridian in your Bai Hui, and you will see this is system 4, right? System 4. System 4 is opposite, like the heart and the heart is on top, and this is gallbladder, and heart is yin meridian, gallbladder is yang meridian. So you from yang through yin through yang. So you're using yang energy to help yin energy to help yang. Okay, yeah, the Chinese clock, that's right, the Chinese clock. We call 子午流注12时辰. Yeah, the Chinese clock. So the needles always go through. It's more powerful. You try it out. You can just do, this is Bai Hui point, right? You can just do needle in here, not going through the Bai Hui, just around the Bai Hui point. And you can do all needle actually go through the Bai Hui point, go to the opposite side. And I suggest you use thin needles. I needle myself, so I know what the feeling is. If you use 0.25 times 25 mm, 0.25 that's thicker. I only use 0.16, and 0.16 is good enough. It's good enough, and it's very effective. The needle, the picture that I showed on my Facebook yesterday, they're all 0.16, and the patient can't even feel pain sometimes. But you need to know how, when the patient feel pain, you slowly go in, feel pain, you change direction. You don't want to feel anything. Now, just tell them, if you tell the patient, if you feel anything, please let me know. I don't want to be the pain. I don't want to feel the pain. It can be painful, or just needle in, and a lot of needle in, and the patient says, "No, that's fine. Just about tightness, no pain." But if you stimulate you're allowed to stimulate the needles. When you stimulate it, and you put 12 needle, you get few results. Bang, all the pain gone. That's great. Or you put all the needle in, bang, the pain gone, just about all gone. But the patient says, "Oh, okay, yeah, it's pretty good, but I can still feel something in here." Like a patient have lung collapse, and she can lay on. She always have some discomfort and pain in here. I put 12 needle in there, bang, she feel quite good. She used to have sweating pain, and sweating gone, and she have less sensation. She get pain, but she get less sensation over here as well. And she can feel the blood flow go through the body, and the pain is gone over here. Straight away, the pain over here and here gone. But the lung collapse is the worst one, because you can't sleep on the sides, you can't sleep on the back, So that side's collapse, but she can't lay on the other side, because when she lay on the other side, the lungs gonna collapse on the other side, For it can't stay still. The structure can't stay still. It go there. So she has to lay on here. When she lay on here, the lung here can stay still in here. So that lung will collapse there and there, give her more space so she can breathe properly. So she has to lay on here. This side of the lung collapse, she need to lay on that side. Okay, but she can't lay on the other side. She can lay on her back. Lay on this side, give her more space to breathe in. So what happened is, so I put 12 needle in there. Okay, she said, "Wow, I can breathe easy now." Laying on her back, she can breathe better now. And then I asked her to move. When she moved and she catch the pain in here, I said, "But that's a bit better, but still there." And I went in the needles. I got to the meridian. You find out which meridian is that. So you go to the meridian, the Chinese clock meridian. You take out a needle. You see, you take out a needle, and you put it in. Just cover the area. When you cover this area, it will be a bit painful. And you put it to 3 layer. The different deep, in and out. So you tell the patient when you do this, you say, "Well, you need to, it may be a bit painful or more sensation, but I don't want you to feel pain. So what you're going to do is, you tell the patient, as soon as you feel pain, the discomfort, you let me know, and I'll stop it. Okay, I don't want you to feel pain." And you in and out, and the patient said, "Wow, this is a bit more sensitive now." Okay, that's okay. Then you stop it, and you pull it out, and you change the direction and keep going in. When you go in, because the needle is just that far, go in and out, in and out. When you slowly in, they feel a little bit painful, stop it, and pull out and change a bit of direction and keep going. Cover the area. And once I finish it, I say, "Well, try it again to move." I say, "Oh, that's all gone." Simple, you see. That is why I call, in the textbook, Bai Hui can treat everything. But why? Yeah, it's about acupuncture, sorry. But essentially, if you go for textbook Bai Hui, you see that, wow, Bai Hui can treat everything, everything. So I got the light on. I just turn off the light, save some power. It's in the morning. So I'll tell you what, in the textbook Bai Hui Point, Bai Hui Point can treat everything. It say that, well, it can treat headache, it can treat heart problem, it can treat stomach problem, it can treat digestion, it can treat kidney, everything is in there. But the question is, in your clinic, if you just put Bai Hui Point and you ask the patient, "How's your arm pain?" Still the same, and the patient come and have chest pain, you put Bai-Hui needle in there. How's your chest pain? Still the same. Why it didn't work? Why the textbook say the Bai-Hui point can treat everything, but in reality, Bai-Hui can't treat everything. That is so funny. That is because, yes, Bai-Hui point can treat everything, but in a different direction. If you put Bagua, if you put Chinese clock in it, if you put the meridian, you know where the meridian, which direction for which meridian, which organ, then yes, Bai-Hui point can treat everything. That's how I figured it out, When I look at the Bagua when it's Chinese clock, and I used to learn naval acupuncture. Then when I learned Dr. Tan's method acupuncture first, and I have the idea of magical 12 and magical 8. Then I learned naval acupuncture. Then I see, wow, we can do all meridian in a navel point. So why don't I put all the strategy of magical 12 and magical 8 and a navel, and I put needle in, and I ask the patient how they feel. They say they feel great. I say, okay, that's great. I can actually do magical 12 and magical 8 strategy on one point. Then further on, I say, well, if I can do this on navel point, 神阙, right? But Bai-Hui is another way to go, because Bai-Hui can treat everything in the textbook, in the classic book, and say about that. But we haven't figured out why it actually can in real life. And I put the Bagua in it. I put the Dr. Tan's strategy, magical 8 and magical 8 plus 1 and magical 12 on Bai-Hui point. Yes, it works. That is why I introduced to you all you, and happy day been using Bai-Hui 8, magical 8 for high blood pressure, and works very well. And I show you yesterday all the picture, and when I back to my clinic, I show you magical 12, magical 8, how they treat pain, how they treat lung collapse, and how they treat depression. Yeah, all this thing using one point. But if you're just using one point, you don't know which direction related to, connected to which organs and which meridian. Hey, Bai-Hui won't work. If you simply just put one needle in there, no, Bai-Hui is not going to work in that way. Yeah. Very grateful for all this information. Thank you. Now, I just encourage you guys, because I learned a lot from other master, and I try to combine it all together. I switch the idea to one point, and it works. Then I'm happy to share with you, because again, I'm doing this live videos, my goal is how to help as many people as I can, and including patients and including acupuncturists, because by encourage you to use acupuncture or acupressure point, and when you learn it and you start to apply for yourself and it works for you, and when people around you, your family, your friends, they start to get these conditions, and just happen that you know me, and just happen that you have learned this, and and you just started to do something for your friends or for your family, and you relieve the pain from them, it make them comfortable, and it give them some advice on, hey, you need to do the diet. If you're doing the diet and you tell them about how to follow the diet, and you actually literally you change their life, you help them change their life, and you save life. So we save life by doing little. I'm not a policeman, I'm not a fireman and go and save people's life like this, but we save people's life in a different way. And if I encourage you to do this as an acupuncturist, you use my technique and my knowledge that I share with you, then you apply it on your patient, that count that I'm actually helping those patients as well. And if you are not an acupuncturist and you use my knowledge to do the acupuncture point, and that count that I'm helping you, and you help other people, that count that I, and my goal that I want to help as many as I can. That's why I'm doing live video every day. All right. My time is very valuable because I can see my patient earn money, but instead I just here to help you and share my knowledge. I see, thank you for my team, because I have a great team and they are working right now while I'm doing, oh no, not yet, we start at 9 o'clock. It's 8:40 in the morning, 8 o'clock, 40 minutes. Yeah. And my, so I have manager to manage all my clinic stuff for me. And she just report to me what, most of the time I listen to her. She just tell me, I'm going to do this. I say, that's okay. Thank you. She managed everything. So that's why I have time to, and here to talk to you guys. And I have my team acupuncturists who help me to treat patients. So I only work 4 half days in a week to see my patient, put all my patients together and see them, to help them. And the rest of the time I'm doing my books, live video, and film some video that education, encourage everyone to how to use acupuncture and acupressure to help themselves at home, and encourage people to change lifestyle, change the diet, and to become healthier, right? So, well, that's it for today. And thank you for everyone being here. And please share this video, because I would like more and more people to get this information. And when you share, you actually help me to reach my goal to help more and more people. All right, stay awesome, and I'll see you tomorrow morning. Tomorrow is Saturday in here. Again, 7 or 7:15, we'll start our live video in here. Stay awesome, and I love you all. See you. Bye-bye.